Were you recording? The research shows discs do heal. Discs heal. Did you know that? Yeah, they do. Have I got your attention? Brushing your teeth, putting your socks on. It can happen to the best of us. Quick shout outs. Mint Wellbeing, Fitness Space Wimbledon, part-time athletes, all of y'all. Another short, snappy video for you this week on slipped discs. Quick disclaimer. There's many reasons why you can get lower back pain. Please don't jump to conclusions and diagnose yourself with a slipped disc. Go and see a medical expert and get the right diagnosis. Can you actually slip a disc? The answer is no. You physically cannot slip a disc. There's no such thing as a slipped disc. What people are referring to is a herniated disc or a disc herniation. This is the first part of a two-part series. This episode will teach you the anatomy about disc herniations and why you're in pain. The most common area for disc herniation is the lumbar spine. That's your lower back. This actually accounts for 95% of disc herniations. When you have a basic understanding of the anatomy, you're then much more aware of why you need to do the rehab. So if we have a quick look at the anatomy, within the disc, we have two main parts. We have the annulus fibrosus, which wraps around the outside, and we have the nucleus pulposus, which is a slightly softer material on the inside. As we age, the bit in the middle, the softer bit, gets a bit less hydrated, and both parts become a little bit more uniform rather than having two distinct materials. As that middle, softer part of the disc loses its hydration, it then becomes weaker, which means it's more at risk of injury. As a chain of events from getting weaker and less hydrated, we then start to develop what's called a disc herniation, or as some people call a slipped disc. If we look at the spine as a whole, not your spine, just any spine. It's the model. So when we look at the spine, we've got 5 lumbar vertebrae. In between all of those vertebrae are discs. Now those discs are what herniate to cause our pain. When the disc herniates and pushes through into the thecal space, it can often press on the spinal cord or a spinal nerve root. And this is what causes the neural symptoms, the pins and needles, the pain, the referral down the leg. You might be wondering why you might only be having issues on one side. And that's because in the middle of the discs, running up through the back, is a big longitudinal ligament. This thick structure stops most disc bulges from pushing out centrally. And what that means is that the disc will either herniate towards the right or the left side. As I said before, the chances of surgery are relatively slim, and your own immune system should do a good job at regressing that disc. If you've come here because you've been diagnosed with a disc bulge or a disc herniation, don't let your MRI define you. Unless you have severe neural impingement or neural compromise, you should not need anything more than conservative treatment. It's important to note that surgery is seen as a last resort, and your physio and rehab is the avenue in which we should pursue and should see good outcomes with. Studies have shown that discs do heal, so trust the process, stick with it, and keep on doing your rehab. The goals we want to achieve from a physiotherapy perspective are motor control exercises, activation exercises, managing your pain, and returning you to exercise as soon as possible. Now that you know what's happening, please check out video 2 and follow the steps on how to help yourself. Thanks for watching the episode, guys. Hopefully that'll give you a bit of a better understanding on what a disc herniation actually is. Send that to anyone who you feel may benefit from it. Part 2 is going to be on the rehab for disc herniations. See you there. P.S. Like, subscribe, share the Instagram, share the YouTube. I think it helps me, but as long as I'm helping one of you guys out there, then that's all that matters. Cheers. PPS, last one. If you're a full-time athlete, you're still allowed to follow this channel, just for the record.